this tutorial, we will examine the appointment screen. More specifically, we'll examine the calendar and how we can go to the various appointment dates. We'll see how we can enter notes. We'll go through an example where we will enter an appointment with all the necessary information. And lastly, we will examine the options available from the appointment screen. The appointment screen is a central part of the operation of Visual Dentist. A lot of the activities in Visual Dentist usually begin in the appointments screen. We will examine the simplest case where we have one dentist and one chair. The software can operate with multiple dentists operating on multiple chairs. Depending on the needs of the dental practice, the software can be configured to be either dentist-centric or chair-centric. We will address these features in future tutorials. The appointments screen is divided into 4 basic areas. On the top right, we have the calendar, which is used to select the appointments for a specific day. By default, the calendar opens to today's date. To select a different date, simply click on the date. To return back to today's date, click on button Today. The waiting list button is used to log an electronic message for a dentist regarding a patient, and we will show an example later on. On the bottom right, we can enter reminder notes. These notes relate to a specific dentist for the specific day. Reminders can range from logging in calls from patients to birthday reminders. As an example, the dentist assistant may log in a note saying patient Tim Flagg called at 2 p.m. Call back. A second note may be pick up laundry. If we call patient Tim Flagg, then we can check it, and immediately the note goes to the bottom. On the main screen, we deal with all the information that relates to a patient's appointment. To explain matters, we will add an appointment for a new patient. Assume that new patient Tim Flagg called and would like an appointment at 5 p.m. today. We go to the 5 p.m. time slot, enter the last name, first name, and phone number. Press enter. There is no patient with this name. Do you want to add the patient? Yes. Here we can enter a mobile number and the dentist. By entering the new patient in the appointment screen, we have automatically entered the patient in the patient database without doing any other work. When the patient arrives, we can note the arrival by clicking on Smiley. In the work, we can leave this empty, but if we want, we can just select checkup, extraction, scaling, or since there's a yellow border, any box that has a yellow border, we can double click on it and it will open a list of options that the user can add. At this point in time, we have checkup, extraction, scaling. We can add, for example, root canal treatment. Also, we can add some color to the options. Let's say we know for a fact that the patient will do a root canal treatment. We can say root canal treatment will have it as this color. So when I come here, if I pick root canal treatment, it will appear with this color. In the notes, there's a plus sign. This plus sign will only appear for new patients, so that the dentist knows that this is a new patient. If we expect that half an hour will not be enough and would like to block from 5 o'clock until 6 o'clock, then we'll simply drag the patient, and now the full 1 hour is blocked. On the bottom of the screen, we have several buttons that offer the user different choices. Visual Dentist focuses on error prevention rather than error correction, and in many cases specific buttons will be disabled if the functionality is not applicable. For example, if we point to an empty time appointment slot, like let's say 10:30, button dental record, it is disabled, as are disabled other buttons, since the specific buttons are associated with the patient. In other words, since at 10:30 there's no patient defined, there's no dental record associated with a blank patient. Looking at the buttons from left to right, the dental record shows the dental record and work that has been done on the patient. The patient details, apart from the address, emails, contact numbers, it includes other relevant information. The appointment renewal is something that we will use if we want to renew an appointment. If we want to assign an appointment for 10 flag for the 20th of the month, we just click on appointment renewal, click on 20 at 1 o'clock, so we don't need to re-enter the patient. Go back to today. If we want to change appointment, say we want to change the 5 o'clock appointment to 4 o'clock, simply click on change appointment, click 4 o'clock, and it's moved over there. If you want to undo, just click on undo. The scheduled appointments are all the appointments that are scheduled for this patient. We can print it and give it to the patient, or the dentist can have a look to see when the patient is due. The weekly schedule will show us all the appointments for the next 7 days. In this case, we have the 2 appointments here and the one on the 20th. The patient index is a list of all the patients. All dentist appointments. This is useful if we have more than one dentist, and we'll review this in future tutorials. The labs. This is useful if we want to look at any work that is due for this patient, so that we can coordinate for the work to arrive before the appointment of the patient. This is where we make payments with the payment all. The SMS button will help us send an SMS message for this patient, and MS Outlook will synchronize the appointments for this day with MS Outlook so that the user can synchronize MS Outlook with his smartphone.